folks, welcome to the next segment. Now that you've heard corporates and now you've heard the large Indian companies that have made it great, we are now going to the Silicon Valley folks and talking to three very interesting startups who have made it big in the digital space. So without a further ado, I would like to invite Deepti Desai, who is one of our very own. She used to be working with TiE Silicon Valley, and now she is the Director for Marketing in Innovaccer. So Deepti, over to you.
Thanks, Naveen. It's truly an honor. I'll be moderating this session on building global unicorns today. But before I begin, I would like to thank the organizers of both IIM Ahmedabad and TiE Mumbai for all this hard work that they've put in for this amazing two-day conference. We've had some outstanding speakers that you've heard from, talking on everything from how corporations are innovating to winning in India. And in the keynote following this one, this is extra special, you'll be hearing from an amazing woman, a master fermenter, a pioneering entrepreneur, a global influencer, and a passionate philanthropist, Kiran Mazumdar-Shaw. She's a role model to me and many across the world, and I'm looking forward to hearing her keynote. And that will be moderated by the president of Mumbai, Amit Mukyam, President TiE Mumbai. So stick around. But in this session, you will hear from three C-level executives, and I would invite them to put on their videos so that you get to see them. They are executives from three unicorn companies in the US that were startups just a few years ago. First off, I would like to invite, I thought I saw Anmol, but if he is not here, maybe I can move to the next person, Mahesh. So Mahesh is the CEO, chairman, president of Omega Therapeutics, a newly public biotech company that is pioneering the first systemic approach to using mRNA therapeutics as programmable epigenetic medicines. They're able to do this by controlling the fundamental process through the Omega epigenomic platform, which enables them to connect the root cause of the disease with the genes that are, getting upregulated, downregulated. Now that's precision medicine. And their vision is fundamentally to transform human medicine to treat and cure serious diseases. Just last month, I have to say, Omega announced its intent to go IPO, and Mahesh and his team were in New York City at NASDAQ ringing the bell. So this is just fresh off the news, and I would like to invite Mahesh Karande, President of CEO of Omega Therapeutics, to introduce himself, talk a little bit about his journey through the world of Novartis, Intarsia, Microlid, and now Omega. And also, Mahesh, please do share one fun fact about yourself. Mahesh.
So you want me to go ahead and introduce myself quickly? Just my journey, Deepti? Is that what you're saying?
Just, yeah, the exciting things that you've done and what people over here might want to listen in this.
Yeah, great. No, thank you. Thank you for the opportunity, and thank you very much to TiE Mumbai, as well as Ahmedabad, and you, Deepti, and the team at Innovaccer. So much appreciated. So it's an incredible opportunity, to be able to build a company like Omega Therapeutics. And we went public about a month ago, and we have attained so-called unicorn status. We are at about 1.1 billion valuation, which is actually pretty good. So quite excited about that. In terms of life and journey, look, I grew up in Bombay. I'm a Bombay born and bred person. Can never get Mumbai out of my system, but I've lived in America for a long time. And, in terms of my background and experience, I spent several years at Novartis Pharma, running businesses across the world in various senior management roles. My jobs took me to a role where I was the head of strategy and business development for everything from Africa to Australia. Used to be on the road 3 weeks a month, was fortunate enough to visit 70 plus countries. When I ran Egypt, I had the dubious distinction of going to Egypt, and 6 months into my job, the Morsi government fell and the coup happened, the second revolution started, and I had to sort of without a playbook, really, shepherd my team of 2,000 through that. And then I was asked to run Africa, where Ebola hit. So kind of things, were very interesting. I had to deal with Ebola and then the oil crisis of 2015, where the entire Africa business decimated, but we were able to keep our business flat. So look, lots of learnings there, right? In terms of how you build teams, how you actually grow businesses, which have allowed me to bring it to bear on Omega, and happy to chat about that in this conversation. In terms of fun fact, I'm a foodie, and being Indian foodie from Bombay, I'm actually Goan. So interestingly, my favorite food in the world is Indian food, and I still, when I go to Bombay, try to go to all of the old joints that I used to go to. One of my favorites is obviously, two of my favorites are Delhi Darbar, in Kamadipura, and the other one is obviously Paremia. But that's a fun fact for you guys.
True. I go to Bombay to eat food on the road. It's so much fun. Thanks, Mahesh. Next up, I would like to introduce Anmol. Livongo and Anmol go hand in hand. And Livongo, as many of you know, began its journey as a diabetes management company and has now expanded to blood pressure management and weight management too. And the interesting thing was it created a new business model that allowed us to reduce the cost of care through the integration of technology while improving the quality of care received by the patient. Just last year, just happening like 1 year ago, Livongo was acquired during the pandemic by Teladoc Health for almost $19 billion. Wow. So I think there's a huge story there, and I'd love to hear it from Anmol Madan, who incidentally also was the co-founder of Ginger, another company before that, and is now the chief data scientist of Livongo and now Teladoc. So please introduce yourself and tell us about this amazing journey you had in healthcare, and also one fun fact about yourself.
Thanks, Dipti, and thanks again for having me on this session. So, I started my healthcare journey over a decade ago. Coming out of my PhD, I started a company in my bedroom, and I think similar to many of the folks here in this session, at that point I didn't really know much, and then I kind of dived headfirst into sort of the healthcare entrepreneurship kind of side of things, and grew that company, raised several rounds of venture financing, built a business out there in behavioral health. And what we had to do at the time was kind of really define what behavioral health could be in a new digital world with comprehensive care, with on-demand care, and all those capabilities. So did that. And then had the fortune of joining Livongo when it was pre-IPO about almost 3 years ago now. And, kind of grew with that company as we went public. At the time, we were the largest digital health IPO. This was about 18 months ago, 24 months ago, and things have changed obviously since then dramatically. And then have a similar role now at the combined company at Teladoc. And so, I've seen companies at every stage, sort of at the 2-person startup sort of founder, kind of stage, all the way to now a 4,000-person company with a couple of $1 billion in targeted revenue for this year. So, I'm very grateful to have worked with incredibly talented people in every stage.
And I would say, if I had to add one fun fact about Anmol, I sometimes wonder if he loves interacting with startups, right? And engineering types, I could say, that are getting into healthcare. So if you are one of those, he would love to chat. I think he's really very good advising startups too.
Always happy to help with that. And the other fun fact is my wife and I are having our first baby in 2 weeks. So that's been, I don't know what you expect on the other side. I feel like a lot of people here may have good advice for me, but yeah.
Yeah, that's right. I mean, you want a little bit, I was like, oh my God, maybe he's having that baby today. So anyway, so we heard from a company that was acquired and another company that just went IPO. And you might say, what's next? Well, it's this new kid on the block that gained unicorn status last year and showed 300% year-on-year growth through the pandemic. As you know, many of you know that healthcare has troves of information that is fragmented and locked in electronic silos. Innovaccer, which incidentally means innovation acceleration, is bringing this information together using a health cloud that not only unlocks the power of the data, but also provides a platform on which new digital services and healthcare solutions can be built with native interoperability. Another fun fact about this company was that it was founded just 6 years ago, with most of their development team coming from, guess where in the world? India, right? So I would love to invite Kanav Hasija, founder and the Chief Customer Officer of Innovesa, to tell us how they literally stumbled into healthcare and how they were able to make it a huge success. And yes, of course, one fun fact about yourself, Kanav.
Sure, Deepti. A lot of folks ask me in the startup world is like, why healthcare? It's so difficult to penetrate. It's difficult to learn, and all the nuances there. So I'll share the journey of ours. Around 7 years ago, we realized that the cost of digital data storage was going down year over year, and the rise of data management tech was not compensating that trend. So we knew there will be more data ponds than data lakes in organizations, and someone needs to solve for that. We were not into healthcare day one. We were solving problems for researchers, for enterprises, ranging from Disney to Wolters Kluwer to NASA to Harley Davidson, like all over the globe, right? So, but we soon realized that our data platform journey cannot grow and scale at the scale we want to by being vertical agnostic. You can be a cloud operator and scale verticals, or a neutral tech operator, but if you are playing in the data space, you need to be in one vertical. The fun story here is in 2015, we said, let's explore fintech, govtech, and health tech and see which one we want to pursue. And we were data geeks at heart, right? So the story goes like this: we choose the best conferences to go to in all these three areas, and we just realized there's a conference called HIMSS. It seems to be like a big conference. We don't know what it is, so let's go in there and see what happens. And we see those 10,000, 20,000 healthcare professionals, embracing their journey at the conference. And when we start meeting them, they start throwing all the 3-letter acronyms at us, and we have no idea what that means. It's all going all over our head, and we just found someone who wanted to solve a real data problem, and they found that we are real data people. So they gave us a chance, and that's how we penetrated into healthcare. The work we did for them, we kind of wrapped it up in 3 months, and they were shocked that their previous vendor could not do it in 2 years. And we were shocked why they were shocked. And that's how our journey into healthcare started. Is like, why is data a big problem in healthcare? It's not being solved. If you apply the first principles of data management, you can solve it. So, I mean, the key learning is it's not hard to get into healthcare. It seems hard from the outside. But at the same time, our journey now is we are advancing from having done all the hard work in unifying data and making it secure and making it available in a good format, to empowering this health cloud journey where new startups who have problems in getting the right data, getting the customers in healthcare, or getting it in a secure way, those problems are solved through us. Now they can start developing the true analytics and the workflows on top of that to solve for it. And truth be told, how much money we raise going in the future and how much time we invest, we will never solve all workflows in healthcare. There are so many nuances. So if there are 1,000 startups who can come in and form a unicorn status, there is space for that in healthcare today, globally. So we welcome that opportunity, and we welcome the team, the global community, to just keep coming in. So, fun fact, when I first came to US, I was in a law school in New Hampshire. So I studied law after engineering, and then went back to data. So that was a very less traveled journey. But during my law school in New Hampshire, I used to play pool and became a pool champion in a very small town in US. So that was fun.
Wow, incredible, right? And you heard Kanav say that there's so much to be solved still in healthcare. So lastly, I'd like to introduce myself. I'm Dipti Desai. I'm currently a board member at TiE Silicon Valley and also a board member at IIT Bay Area. And if I have to say what are my passions, I have three distinct passions. One is healthcare, one is startups and technology, and one is US and India. And I'd like to try and work at the confluence of those three. One long-term goal, going along with the lines of Anmol and Mahesh and Kanav, I have is that I would love to see the confluence of all the stakeholders in healthcare, from hospitals and physicians and payers and pharma to startups and VCs and academia and enterprise. All of them, they're talking different language. It would be great to bring them all together and bring the patient back at the center of care so that we can all care as one. And I know we can all collectively make it happen. So looking forward to that day. So back to this topic about entrepreneurship and healthcare. Entrepreneurship is a perilous journey. The statistics speak for themselves. 8 of the 10 startups die. And I'm sure it's not for the faint-hearted. Our speakers here have succeeded against all odds. What made that possible? Is it in their DNA? What is the secret sauce? I'm sure it was not a bed of roses all the way. What was that one driving factor that kept them going despite the challenges? I'd love to hear from them to say, what are the challenges that you faced in your journeys? How did you overcome them? Mahesh, you want to take that first?
Yeah, sure. Thanks for that question. Look, I mean, I think, most of the people here in the panel, as well as the attendees, particularly are entrepreneurs. And I think the one thing that keeps our company going, and we have been in existence for 4.5 years, to go from a concept which is exceptionally esoteric science, which was really delineated in 2016. So nobody really knew the science before 2016. Nobody knew that you could actually replicate nature's operating system, go in, at the epigenomic level, look at the organization of the genome and use that to tune genes like you would, like a rheostat or thermostat, to the right level of biological expression and thereby cure disease, right? So nobody knew that, to prove that out requires a lot of grit. And, I credit my team. So that one thing is grit. You have to have, the grit to continually do experiments. And biotech is a little bit different than tech, right? I don't think it's more or less complicated or more or less, in terms of, the effort needed. But biotech is a little bit different because science needs to be proven, right? And I think that grit. The second thing is the purpose, right? I mean, imagine we set up a purpose for the company very early, right? Which is essentially changing medicine to save people's lives. Now, when you put it in that context, that you have to do this really well. So eventually you can get these medicines to patients. These medicines don't even exist to patients that you could treat intractable diseases with. So that keeps you going. That's a huge purpose. And then, the third thing is to make sure that you are able to, there are no, like the saying goes, no sacred cows. So you cannot have dogmatic thinking. And to me, that sometimes becomes a problem with startups because I think the founders, people have ideas and you have to be able to pivot. One of the things that, we do really well here, and I think as we even recruit people, one of the most important things is the ability to pivot very, very quickly, right? All of these ideas are your babies and your children, right? But you have to be able to continually hone it so that it's eventually successful. And I think that's where a lot of people really falter because it's a very dogmatic way sometimes of approaching, saying, this is the idea, I'm going to just make it work. But you can figure out that there's a little bit of an allied space you can go into. I mean, so those are my thoughts. And I think if you keep going on that, right, you start reducing the chances of failure. I mean, I wouldn't say that that is a sure shot recipe for success, especially in biopharma, because biopharma, it's proving out science, right? But that's what I would say.
Yeah, grit, determination, and flexibility to be able to think of another point of view. Anmol, you want to go?
Yeah, I mean, I would say something similar, maybe in slightly different words, but I think there's so going through most building a unicorn, and we have some incredible successes here, but usually it's a decade-long journey, right? Now you guys are doing it in 5 years, kudos to you, right? But usually it's a multi-year, decade-long journey, right? And so when you look at companies that scale, I think a lot of it actually comes down to you can only power through those journeys if you believe in the vision. Right, you have to believe in the bigger reason why you're doing it, and healthcare offers a great mission, a great vision. Right, you're changing people's lives. You can directly impact the healthcare your friends or family members or loved ones receive if you are successful in that mission. So it's a very powerful mission. But I think to the point that Mahesh was trying to make, part of what is really critical is approaching it with sort of curiosity or flexibility. And I use the word curiosity because the go-to-market, the business model, the customer, the product features that are going to make you successful with that customer, those will keep evolving, right? So for the business in its early nascent stages, you may be selling into employers, maybe it's SMBs, then you graduate to enterprise clients, and you graduate to health plans. And each of those will have a slightly different go-to-market. They'll have a slightly different, some cases dramatically different product feature set. But if you're true to sort of the vision and the problem you're solving, and you're kind of looking at those with flexibility, I think then that's really the way to sort of stay. I mean, a lot of it comes down to sort of the emotional resilience to power through the ups and downs, right? The funding fell through, the CTO left, like all the things that happened. And part of it is the thing that powers you through that is the vision, is really the belief that this should exist in the world.
Thanks, Anmol. Maybe I can go to the next question, and maybe Anmol and Kanav can answer these. I feel like one day you're a startup and then you're not. There's a lot that happens between those 2 points in terms of growth and scale. I mean, if you have a few words of wisdom to audience, and can you tell them, what does a successful scale up look like, and how do you go about doing the scale up? And does it involve going global? Do you need to have different challenges and obstacles that need to be overcome to go global, or even to come to India? Anmol, Kanav, anyone?
I can take it first. I think what we have learned the hard way is staying true to the outcome metrics and looking at that is very important. And how removing all the bottlenecks to scale that machine up, right? That machinery could be in go-to-market, how many dollars you spend in go-to-market and how many you get back is the true outcome metric. And if you don't track that, and if you don't improve that over time, you miss out on what really you need to remove as bottlenecks. Or it could be in solution development, how much you're spending in R&D and how much you're getting back, to all the way to how much you're spending in customer service and how much you're getting back. Every organization has bottlenecks by design, and high growth startups will have more bottlenecks by design that they will create on the way while going in that path. So removing bottlenecks and being true to your metrics to see those bottlenecks, the more faster your engine is, it's gonna be more successful going forward. So remove bottlenecks is the first thing. I think the second thing is do not expand globally or even in a different country altogether until you have a good product market fit and good outcomes proven to the customers in one geography. It takes time to get the product market fit, and it takes more time to figure out that the outcomes are consistently coming to our customers, right? And if they're not consistently coming, you haven't figured it out. And until you haven't done that, don't go beyond, because healthcare is local. It has a lot of commonalities across the world, but it is still local. And those are the 2 comments that I would, stick to, true to the heart, and then go globally.
Yeah, that's That's great, Karnav. I can jump in and add a couple more there. So I think, I think this one is sort of fairly obvious, but I think it's important. I think you need to be honest with yourselves about, like, we all need to be honest with ourselves about product market fit and where we are in that journey, right? And often there's a tendency to sort of paint a vision, obviously for our teams, often for even the promise to investors or future investors. But I think internally at some venue, whether it's the CEO and the CFO getting together, or whether it's the leadership team getting together, kind of really understand where are we, what does success look like, what do we need to achieve in the next quarter, the next couple of years, right? And kind of thinking about it not just sort of in a very reactive way, but in a very intentional way, and saying, hey, this is the market right now. And if we want to be a $100 million revenue company or a $500 million revenue company, here's what we really need to unpack. And here are the trends we're seeing in the market. So, and I think that exercise is creating that muscle, taking your whole leadership team out once a quarter, locking yourselves in a room or whatever venue you choose, winery, and kind of working through that exercise consistently is a great sort of, I think about strategy is really key. The other piece that I think really is probably the most important piece for scale is actually the people. And the company is directly a function of the quality of talent and leadership and people you have at each level, and particularly if you're growing, scaling quickly, having senior leaders come in. I mean, I'll give you an example. Part of what I loved about Livongo, and I think was key to our success, was the quality of the leadership team that we had. Right. So Arnon, our chief people officer, was the chief people officer of Tesla and Google. He worked for Elon Musk. Right. Glenn had taken 3 companies public. Zane was the president of Cerner. Jenny was the president of Gaslight. She'd taken that company public. Dave, our CTO, was a CTO of Evernote. Right. And so, like, I was like, Courtney, our CMO, had launched the iPhone with Steve Jobs. I'm like, I'm never going to work with this caliber of leadership in my career. Like, this is the very rare occurrence, right? So if you think of the caliber of team that you want to build, if you're going to build a company that's as long lasting as some of the famous companies we all think about, we want to emulate. I think thinking about that, and not just always hiring from outside, but also thinking about where do we have pockets of people in town that we can grow to that level. And this is where, whether it's people with more experience on the board or advisors or investors who can help groom that, senior product leader who can be a world-class chief product officer or CTO or equivalent. I think that's really what it comes down to. A lot of it, I'd say 75% of that is people.
So you heard, right? Startup success is based on many factors: good idea, good business model, investment, customers, product market fit, maybe luck, but it finally boils down to team and execution, right? And Anmol made that happen. But, maybe in a biotech world, maybe it's a little different, right? Can you speak to the challenges of finding talent, Mahesh, in the biotech world? Is it similar to where you're talking about data and science and engineering as opposed to where you're actually going down? Is that the same problems you see?
Well, I think fundamentally, in any innovative industry, where talent is needed, you will see that problem, right? Because I mean, good talent is rare and good talent is in demand, whether you're in tech, whether you're in fintech, whether you're in health tech, whether you're in biotech, right? I mean, I think that's a big thing. Here in Boston area, in Cambridge, just in Kendall Square, there are 400 plus startups. I'm not even counting the startups that are outside, right? So you can just imagine the war for talent that exists. And there are some incredibly talented people in this Boston area. There are about, I think in the larger area, about 60 universities. I mean, we all know about Harvard and MIT, most people in the world, but about 60 universities, small, big colleges, what have you, right? So there's an incredible amount of talent. So look, I mean, to me, hiring the right talent, I agree with Anmol in the sense that you have to have the right talent that fits the company, right? You have to have a culture that actually allows that talent to really come and do the work that you hired them for. And then talent grows. I mean, these are very, I mean, at least the areas that we are working on, it is just so new that you kind of are figuring it out. So you need to have super smart problem solvers, but at the same time, talent, intelligent people, scientists can sort of, ruminate in the pie in the sky ideas. How do you actually take that and make it exceptionally practical, right? And operationalize it. So to me, one of the important things is you need to be able to find talent, but also that talent, you need to be able to channel that talent and, get things into operational mode, because it goes back to funding, it goes back to a lot of things that actually are existential for a startup, right? So I would connect it that way. Biotech has the same issues in terms of finding talent. And I think retention of talent becomes extremely important, right? So you have to be able to pay well. That means you need good funding. That means you need investors who are attracted to it. So it's a nice virtuous circle. But having said that, to me, the fundamental thing that you have to build in the company beyond a big idea, beyond having a strategy, beyond having a direction, is really the culture, the ethos of the company, because that is what you live and breathe every day. People spend more time at work than anywhere else, waking hours, right? We are at home, we sleep a lot when we are at home, but otherwise you're working. So I think creating that environment is exceptionally important. That's the only way you can retain talent, when people believe that they are building the company. And that's what we do here. And you have to be absolutely authentic and genuine about it.
That's so
Yeah,
true.
and actually, can I underscore something Mahesh said, which I think is really important? And I made this mistake earlier on in my sort of startup career, which is, we're used to often thinking of talent as pure technical skills, right? So PhDs, publications, how well do you code? But really, if you want, like at the mid to senior levels, you have to think of it very differently. So the technical skills are a checkbox, but also, can you build a high quality team? Right? To Mahesh's point, can you operationalize and actually have an impact on the business? Or are you kind of running off in the corner somewhere, completely sort of distant from the day-to-day of what the business needs? Are you net positive on the behaviors and the value and the culture we're trying to encourage, right? So things that I value are collaboration, good listening. Are you actually net positive on the whole company in that? Or are you sort of, a jerk who's like really smart? I mean, that's not a good fit for us. And so I think that point is really valuable.
You all came from engineering backgrounds, VJTI, IIT, MIT. As a student, I don't think tackling healthcare was like your goal or aspiration, or was not top of mind for you. And yet today, each one of you is really making an impact in healthcare, which is so important to me. You have a lot of eyes watching you today. Many of them are engineers. What can you tell these engineers? What words of wisdom can you give them? Stay away from healthcare. It's so difficult and there's lots of problems in there. It's going to take a long time, or take an easier path, or no, come solve these problems. People need you. The world needs you. Can you share that advice on why people should tackle this space, or why not? And what are the challenges? There are challenges. What are those? And what is changing? Is it getting easier? Kanav, you want to take that?
Yeah, I think the problem that at least I saw, and what I see with people I'm trying to hire, right, who are not from healthcare before. And there's a saying in healthcare that if you spend 20 years in healthcare, you have become spent. So you need to get those new eyes and new blood coming into the industry to solve it in a different way. So I always have a mix of hiring from healthcare and without healthcare. And the ones who are not in healthcare, they from the outside in, they perceive that healthcare is all about biology, and healthcare is all about studying the body and the organs. But healthcare, just like any other industry, is solving operational problems, or solving outcome problems, or solving consumer problems. The beauty in healthcare for engineers is there is more data, there is more digital data, and there is more digital workflows in the past 10 years that have come into healthcare than ever before. So it's definitely lagged from the other industries, but it's come to a stage that engineering problems can be applied to healthcare finally, and can be applied at a bigger scale than just local 1 or 2 hospitals here and there. Right, so it is the best time to enter into healthcare. If you think there are big giant companies who have solved it, everyone can attest on this call that healthcare has so many nuances and so many cuts that only very few have been solved now. So I would welcome the engineers to come in and solve the problems.
Yeah, Tripti, maybe I can actually say, just sort of supplement some of the stuff that Kanav said, because, the way I see it is, uh, you know, healthcare is obviously, like Kanav said, pretty vast, right? And I think there is an aspect of it which is very, very close to engineering. I kind of happen to be on the completely opposite end of whatever is close to engineering. So that's why I think, it might be helpful for me to comment here. Look, I mean, I think, engineering fundamentally gives you a very good sort of tool set. Words like curious we use, innovation we use, thinking and ability to really structure problems, right? And analyze problems. I think that is important in any part of the world, any business you go to. So to me, engineers can pretty much go into any business, right? Now, getting into the kind of biotech space that I'm in, there are several engineers who are actually doing that. In fact, the chairman of my company and the chairman of the consortium that funded my company, Flagship, he's also the chairman of Moderna. He's a chemical engineer, right? So, interestingly, engineers have been very successful in this because I think eventually it comes down to solving problems. And even in biotech, like pure biotech, and I'm not talking about health tech or, technology related healthcare. I'm talking about pure biology related biotech. You are really seeing a confluence of engineering and biology. Today's world, it's no longer sort of, the small molecule, sort of the chemistry and then the testing the biology. It's literally applying engineering solutions to biology. So if you think about what we are doing, right, our drug, we are used to taking pills and drugs, right? We think it's a chemical entity. Our drug has no chemical in it. Our drug is essentially two proteins that are engineered proteins, right? They are put inside an mRNA. So the mRNA codes for it, right? It enters the cell, that protein is expressed, and then you go and tune genes like a rheostat. I talked about nature's operating system. Think about all of the words that I've used. Engineers are very familiar with this word and these words. So what I'm saying is, I think engineers should fearlessly go forward. And look, America is a little bit different too. I mean, all three of us fortunately sitting here, I think in America, your basic knowledge and basic degree is valued, and then you can go wherever you want. I mean, my journey, I started off with, in engineering. I went to business school. I was fortunate enough to graduate and go to a really, high quality consulting firm. And when I was leaving the consulting firm, I decided I had two paths, whether I go into technology and telecom or do I go into healthcare. I loved healthcare. So I went there, climbed up, and, my engineering background, my training helped me to eventually, be in this position. So I would tell the engineers on this, in the audience to be fearless about it and go in whichever way. Don't be afraid of biology or anything like that. You can pick it up. As long as you have scientific thought and a scientific mind, you can pick up anything.
So true, so true. I think and also kind of mentioned that fresh eyes actually bring a different perspective, right? If you're not trained in that area, you're actually thinking outside the box because you ask questions that other people think dumb, but those are fundamental questions that have not been addressed properly, right? So that brings me to, and you talked about, Mahesh, you talked about mRNA, and that brings me to the next question, which is like, high-level trends and market opportunities. We just saw this pandemic changed everything and new therapies came into play, new vaccines came into play. So there's stuff happening around the world. Do we see, what are the new trends that we are seeing in the US? What are the new trends that are happening in India? Are there unique challenges global? I mean, what can we talk about the trends? What do you think is people need to focus on, and where do you think the next big thing will come from? Anmol, since you founded one company and been part of another, that's very trendy. Can you take the first stab at this?
Yeah, I'll give a couple of points, more so from the healthcare side of things, and then I'm sure these guys will add more so from the biotech and medtech side of things as well. But I think there's a few macro trends we're seeing. So one is what used to be considered sort of telemedicine or virtual care and was a nice to have even 24 months ago, now in the US is a must have. And for primary care, for general medicine, massive growth in behavioral health. Both the companies have been involved with have seen a tremendous amount of success in behavioral health in the last couple of years. And I think across the board, like what is a nice to have is now a must have. And I think that's a global trend actually, which I think, there's going to be versions of that exist. And I know there are companies spinning out definitely in India and in Southeast Asia that are trying to approach, both chronic conditions, primary care, mental health with similar models. So I think that's a global trend. And I think the products that are going to be successful in those markets are going to have to be slightly localized, whether it's companies like Teladoc entering those markets or whether it's local startups coming. There's a difference between the product offering, the value proposition, the price point in the US and what's localized to be successful in, say, India for right now. So I'd say that's a big trend. The other big trend is obviously around data and sensors and just the explosion that we're seeing in that space in healthcare.
Sure. Anyone wants to add to that, Kannan?
Yeah, I think really quickly, going back to expanding Anmol's point is, I think care at home is becoming big and not just the care at clinics or hospitals. So that's a big trend. The other thing is, I think if you compare India, US, China, Europe, right? I mean, US is solving the the cost of care problem. India is solving the access to care problem. And India is trying to go build system of records first, before building the system of intelligence later, right? And China is solving more elder people as compared to more rich people. So most countries go rich and then go old. China went old and then is going rich. So they are solving the automation problem. So each country has their own different trend, depending on what they're doing. But I think in India, building systems of records and building more coordinated care at home or clinics is the big trend to go.
Wow. Yeah. Looks like we have very little time, but we've talked about everything except for the money part. You need money to make that money, and you need to convince people about your idea and your growth strategy. The stakes are high, the cycles are long, people are risk averse, and many times they don't understand the science, right? So what does it take to get that first and second and third and fourth and fifth round of financing that you really need to grow and scale? Is there any words of wisdom for people out there as you build a platform?
Yeah, I could jump into it if you don't, if you want. Look, I mean, I think to me, investors invest behind two things. One is the idea, and second is the team. It's as simple as that. Those are the two things that investors invest behind. If you have the right idea and the right team, I think you have a significant leg up in terms of where you can find investment. Then the story, the telling the story of your technology or your idea, and then actually operationalizing it is important, because that actually leads to inflection points that then investors continue investing. That's to me a very, very simple formula.
Sounds.
Yeah, I think it's idea and team, and then keep on going in the next stages to product market fit, to the unit economics. Well, I think someone asked a question real quick to answer that. Deep tech is a new science or the new industry coming up, wherein the gestation period is long enough to fund than traditional VCs who wants to see returns really fast. So there are to answer that question on if you have a high gestation period on an AI problem, there are deep tech VCs out there who have more patience, I would say, than the others. So look out for deep tech VCs like Pi Ventures in India, which can help you stay at the next pace.
Thanks. I know we're almost out of time, and that was really amazing. This was absolutely fun. I hope all of you enjoyed listening, and there are a lot of questions. All of these three companies are hiring. You can reach out to them on LinkedIn. But before they go, I have one question for them, and this is just a one-word answer. I mean, what is the one word that describes your life journey in healthcare? If you had to just give one word, what is it?
Fascinating.
Fascinating. Anmol, Kanav.
Go ahead, Anmol.
Unending. I feel like it just every day is better.
Yeah,
Yeah,
absolutely.
using a similar phrase, which is learning.
Uh-huh.
It never stops.
Yeah, never stop. There you have it. It's continuous learning. Fascinating, amazing, right? Thanks for sticking with us. We hope our paths cross again in the future. And now stay tuned for this really amazing keynote that we've all been waiting for. Thank you. Thank you all.
Thank you, guys.
Thank you all. Thank you for the very early morning start from the Silicon Valley folks. And if anything that I took away from this session, it is that healthcare and health tech is the new sexy in town. So thank you all.